Well, good morning, everyone. I'm Jennifer Walsh. I'm a Senior Media Officer with the Institute of Medicine and National Research Council. I want to welcome you all for joining us this morning, those of you who are in the room with us and those of you who are joining via the web. Again, this is a discussion to talk about the new report that was just released at 11 a.m. Eastern Time, Sports-Related Concussions in Youth, Improving the Science, Changing the Culture. The report is now available and it can be downloaded as a free PDF along with other related materials at www.iom.edu. This will be a 1-hour briefing unless we run out of questions beforehand. We will start off with some opening remarks to introduce the study and give an overview of the report's findings and recommendations, and then we will open up the floor to questions, both those of you in the room and on the web. Those of you in the room are asked to go to the microphones on either side of the room to ask your question. And those of you on the web, if you can type in a question in the Q&A text box and click the submission button located under the player. We ask anyone who asks a question, if you can please identify yourself and your organization before asking that question. And with that, let me introduce Clyde Behney, the Interim Leonard D. Schaeffer, Executive Officer of the Institute of Medicine.
Good morning. Welcome to the public release of the Institute of Medicine and National Research Council report, Sports-Related Concussions in Youth, Improving the Science, Changing the Culture. Despite the increased attention to and proliferation of research on sports-related concussions in recent years, there continues to be confusion and controversy in several areas, such as the effects of multiple concussions on the vulnerability of youth athletes to future injuries, when it is safe for a youth athlete to return to sports and to school following a concussion, and the effectiveness of protective devices and other interventions in reducing the incidence and severity of concussions in youth athletes. Against this backdrop, in October 2012, the Institute of Medicine and the National Research Council convened the Committee on Sports-Related Concussions in Youth to review the science on sports-related concussions in youth from elementary school through young adulthood, including in military personnel and their dependents. The committee's report, being released today, explores the causes and consequences of concussions in youth, their treatment and management, and the effectiveness of protective equipment and other interventions for the prevention of injury. I'd like to recognize the important contributions of the staff for this project. Morgan Ford was the study director, was assisted by Carol Spicer, Wendy Keenan, and Samantha Robotham. The study was done under the auspices of the Board on Children, Youth, and Families, directed by Kimber Bogard. The authoring committee is represented today in order of their appearance by Bob Graham, who's the chair, Tracy Covison, Susan Margulies, Arthur Marylander, Fred Rivera, who's the vice chair, and Christy Arbogast. Bob Graham is director of the National Program Office, Aligning Forces for Quality at the George Washington University. Tracy Covison is an associate professor of kinesiology and the undergraduate athletic program director at Michigan State University. Susan Margulies is George H. Stevenson Professor in Bioengineering at the University of Pennsylvania. Arthur Marylander is Director of Pediatric Neuropsychological Services and an Assistant Professor in the Department of Psychiatry at Dartmouth College. Fred Rivera is the Seattle Children's Guild Endowed Chair in Pediatrics at the University of Washington School of Medicine. Christy Arbogast is the Engineering Corps Director at the Center for Injury Research and Prevention at Children's Hospital of Philadelphia and is an Associate Professor of Pediatrics at the University of Pennsylvania. Dr. Graham will begin with a brief overview of the committee's statement of task and how they approached that task. Each of the other representatives will then take turns presenting the committee's findings, conclusions, and recommendations. At that point, the panel will be available for questions, both from the audience and from the web, And I'm very pleased to now turn the program over to Dr. Graham.